When you look in the mirror, you just see yourself, right? But what you're not seeing are the trillions of bacteria that are inside of you and even on your skin. In fact, the number of bacteria in your body outnumber the number of cells, human cells, that you have 10 to 1. So I'm here with Dr. Il-Sung Cho, who is an assistant professor of medicine at NYU Langone Medical Center and who is an expert on all these bacteria, collectively called the microbiome, right?
Yeah, pleasure to be here.
We know that obesity is somehow related to the bacteria in us, and we've talked about that before. People can go click on that link that's right next to this, somewhere right over here. But we're going to today talk about some of the other things. What are some of the other conditions that are linked to this microbiome?
So we're just beginning to appreciate how wide the effect of the microbiome is. It relates to a lot of things within the digestive tract because a lot of the bacteria live there, things like colon cancer, inflammatory bowel diseases. But some of the other effects that are more wide-ranging that we're just beginning to appreciate are things like rheumatoid arthritis or cardiovascular disease, some of these things that you wouldn't necessarily imagine to be linked to the gut bacteria, but we're finding that they might be. The GI tract, the digestive system, is actually one of the most important immune organs in the entire body. And it's a huge immune organ. So if you take the small intestine and you spread it out flat, it's about the area of a tennis court. So it's a large amount of immune cells. And when that immune system is activated, it affects not just what's locally there within the gastrointestinal tract, but also things that are distant. So things like rheumatoid arthritis. So you turn on an inflammatory cascade, and that could lead to things like inflammatory changes in your joints, such as rheumatoid arthritis.
All right, well, we'll finish up with something that, of course, no discussion of the microbiome should be without, which is the poop pill, okay? Now, to give a background for this, we know that when we give antibiotics, you can get a condition called C. difficile colitis, which is very serious. It can be very tough to treat, even with the proper antibiotics. It's caused by antibiotics, but you treat it with antibiotics. But sometimes that doesn't work, and they've found that sometimes you can treat the C. diff colitis by giving what's called a fecal transplant, taking the bacteria from somebody who's healthy and bringing it in, and it's done via colonoscopy.
Sure.
And you squirt some in, you squirt in a little bit of the stool, and it repopulates. It's been remarkably effective. And this may sound silly, but we're talking about a life and death condition where people can have this chronically and have their entire well-being threatened, and it works. It seems to work. So the next step, of course, is, well, it's kind of hard to do the fecal transplant via colonoscopy. What if you give it via a pill? So bring us up to date on that.
So like you said, this is a terrible infection. It can lead to death in some severe cases. And the transplant, the fecal transplants have been remarkably successful. We're talking about over 90% success rate when antibiotics fail. And so we're excited about this. But there are technical difficulties with giving a fecal transplant. It's not palatable for many people.
Even though it's, again, we use palatable, even though it's done via
So even the idea of doing that for many people
via the colon, not from above.
Right. Yeah. Makes people uncomfortable,
yeah,
at least.
Of course, it's icky. That's the technical medical term.
That's the medical term
it's
for
icky.
it, right. But the more elegant, so that is somewhat of a brute force method to treat this. But the more elegant method would be to figure out which bacteria are the key players. What are the bacteria that you need to reintroduce into a diseased or infected colon that'll restore order? And that's another thing that we're just starting to understand. So in the microbiome literature, there's a concept called the keystone bacteria. Certain bacteria that you may not have the highest number of them, they may not be the most impressive, but they play very important roles in maintaining equilibrium within the community. And by reestablishing some of those key players, you may be able to switch somebody from diseased to healthy.
All right, Dr. Il-Sung Cho, we're right at the very beginning of this, aren't we? And
Yes.
thinking about, we're talking about poop pills with a straight face, almost a straight face, but it's something that actually might be able to save somebody's life and change the whole microbiome around, and who knows, it could help in other diseases as well. Thank you so much for joining me.
Absolutely, my pleasure.